Good evening and welcome to St. George's House in Conversation. For those of you who don't know me, I'm Gary McKeown. I'm Programme Director at St. George's House, and I'm speaking to you tonight from the Vicar's Hall in the grounds of Windsor Castle. Now, the Vicar's Hall, for those of you who haven't been here, dates back to 1415 and the reign of King Henry IV. It's said that a very early production of Shakespeare's play, The Merry Wives of Windsor, happened in this space as part of an Order of the Garter ceremony. And Windsor Castle is, of course, home to the ancient chivalric Order of the Garter. It's said, too, that that production happened in the presence of the then monarch, Queen Elizabeth I, and William Shakespeare himself. So if in the course of the evening you see a ghostly figure in doublet and hose straying across the screen, that's probably who it is. I'm so glad that so many of you could join us tonight, and I'm especially glad that our guest this evening is the hugely distinguished oncologist, Professor Pat Price. You will know from the biography just what Pat has achieved and is achieving in her work in oncology. And she has devoted about 34 years of her life to redefining cancer care in this country. Pat, I'm so pleased that you're able to join us this evening. And I thought I'd start by looking back to COVID, which already seems like ancient history. But there was a moment where health service, the NHS, the medical sector in general really sold itself. Now, several years later, here we are again with huge waiting lists, staff shortages, strikes at all levels, constant drive for money, and of course money is important, but does it suggest in some way that our health sector had something fundamentally wrong at its core?
Gary, well, thanks for inviting me to chat about this. Yes, I think we have to admit that the health service has lost its way at the moment. It's fundamentally based on sound principles, democratic capitalism. We want the good for others. We want to pool our resources. And it's great. What are the best bits of the NHS that we do not want to lose? We need it to be there in emergency and for people who haven't got any money. We need to collectively work together. We'll be better medicine if we all network together and, get cheaper drugs together, all this sort of thing. And above all, what the NHS showed us, particularly in COVID, we have world-class staff working for us. We have some of the best staff in the world, not motivated by money. They're motivated by their compassion, their will to do good things and to help patients. And whatever happens in the future with the NHS, we must not lose all that. But I think you're right, we've lost our way. But I think in COVID, we can learn a lot of lessons from COVID. I think that's the thing. I think it's shown us the goodness of the UK people. We were very good at pulling together. It showed us that wealth and profit aren't the primary aims of our society. We want to do good to each other. And also it's shown us that health is so important. Really, without our health, we don't have much. So health, I think we should use that and see, and the powers that be should see that this health is an investment, not an expenditure. And it's almost a human right. And health is in everything. It's in our education, in our housing, cost of living. We need to raise the health of our nation, but we've lost our way and we need to do things differently.
And so when you say, Pat, that health is in everything, in education, in cost of living, etc., that suggests to me inequality in our approach to health. And of course, there are areas of the country where the life expectancy is vastly reduced compared to other areas, wealthier areas where it is enhanced. But that's a huge political argument to make. And is there a way of getting this through to the politicians and making it non-partisan
Exactly, because you're right. The future is to have health completely non-partisan. The day we get all the parties working together, that will be when we can move forward, and everybody wants that. But I think it's quite straightforward, really. I think people can see it. We're a tiny country compared with others, and we've got such health disparities. Why should that be? We all watch the same television, we all go to the same supermarkets. So why has there got to be such disparity? And I think it's only when we address that disparity can we actually bring everything up. And we need that. Having a country that's divided like this is not good at all. Mm-hmm. And we've got to help the people who need the most help. And I know we all want to do that.
And is there a way, currently the NHS and health funding sits with government in the Department of Health? And of course, that's important. And that's where the resource is going to come from, our taxation, etc. But is there a model that might work better if we were to take health policy out of government and into some sort of independent position?
That's a big question. In fact, just this week, the King's Fund did a look at 19 countries and thought, okay, I must say UK did not come out very well. We did fall down on a lot of respects, but it did make the point that no system is perfect and most countries modify the systems they've got. So certainly with us, as I said before, those essences of great NHS we must keep. I think we've just got to basically run it better and have the focus being on patients rather than targets and money and following money. And the way to do that, I think, is have an accountability. When we changed in 2013 to NHS England, the government had been responsible for the NHS. Then they gave it to the organisation NHS England, with their providing the money, NHS planning and delivering. But what of us can't understand, where is the ongoing accountability to international groups, experts constantly checking and how we can improve? So without that, without that accountability, I don't know how we move forward. A lot of what I've seen over the last 3 years, we've been running the Catch Up with Cancer campaign now for 3 years. There's no, everybody we talk to says, yes, we must do this. Nobody seems to know what lever to pull to make it happen. Who's in charge, basically? So we need to get a system where we can be more accountable. We can do this. You see what we did with the vaccine task force. We just put somebody in charge, total reins to do it, swept away bureaucracy, got the base people in, did it. So we need something like that now to get us out of this situation. Carry on doing what we're doing now is not going to make things better.
And when you say with the vaccine, bureaucracy was swept out of the way and people were given the freedom to get on with it, is bureaucracy the problem?
I would say absolutely yes. And I see that you almost see it lift a little bit at the start of COVID, when suddenly it was all the front line to the fore, thinking of things, solutions, everything. And it was just that time when everybody worked hard, the dexamethasone trial, where we led the world in it. The frontline staff are amazing, but take it back to its normal day job. And I've seen it change so much in my last 34 years. Frontline staff are told essentially what to do by often people who don't know what to do. And until we have a complete turn it round and get the frontline staff empowered, given the tools to do their job, we're not making the most of it. There are some amazing staff, and with the new, the plans that will be out tomorrow for the workforce, there'll hopefully be more staff, but unless you give them the tools and the freedom to put the patient first and do what's right, you're not going to get anywhere. Once we have bureaucracy, the dead hand of bureaucracy, this is not going to solve things.
So in a way, it could be argued that there's never enough resource. Of course there isn't, but the resource that we have at the moment is being misspent.
Well, it's being spent in the system it's being spent in, but yes, we can't, one political party wants more targets, one wants more money. There's neither of both. There's only a certain amount of money. And as frontline staff, we want to be efficient, but there are ways of making things much more efficient. The amount of inefficiency, there are stories that your toes would curl at them, and they just shouldn't be happening. But we need somebody empowered to say, stop doing that, just do the right thing. And if we put the patients at the forefront of this, and give the staff the tools they need to do and do sensible things, then we can seriously move forward and we can turn this around.
Yeah, and just, Pat, I just want to focus on that for a moment, but about putting the patient first, putting them at the forefront, as you say. So what does that mean? What does that mean in practice?
That means that every single decision we make has to be about what is best for the patient and what is best for health and all the things that we need to do to help patients live without disease, and then when they have got disease, and then when they're elderly. But at the moment, we've just got very tied up in a lot of the top management is all about money flows and targets and accountability. And I think sometimes the patients are just numbers. And for patients particularly, they've got to be first. And I think they need a voice. And I think the British society needs a voice. I think we need to have a national conversation about our health service, and we need to be open and honest and have a discussion and say what we want it to be, not be told what we want it to be. We need to decide.
So you think that the moment has arrived almost for citizens' assemblies? What sort of NHS do you want as a person, as a people, as a community? That's a big ask.
But I think we're nearly rock bottom. I've been pretty depressed over the last 3 years, seeing it getting worse and worse and worse. The cancer target figures are getting worse. They're the worst they were when they were reported 2 months ago. And you think, when is this going to turn around? And you realise it's probably only when it gets rock bottom does somebody be bold enough to say, enough is enough. We're going to get this right. So I feel in some ways we're nearly at that point where it can't get too much worse. So let's get on with this now. Let's be bold and let's get it better and get back on our feet.
Yeah, and it seems, it's a very depressing thesis in many ways, the position we're in at the moment. And yet, as we heard when Sir Leszek gave the annual lecture, there is so much good news about cancer treatment and the prognosis for cancer, etc., that there's this fault line that we can't seem to get across. And I really wouldn't want people to go away tonight thinking it's all doom and gloom, because it isn't.
No,
but there's a fault line.
I think you're right. And I think describing it as a fault line is right, because there is a massive breakthrough. The screening we can do, the prevention, the curability of cancers. Gosh, it's nothing like it was even 10 years ago. But unfortunately, we can't get over that fault line. So we're not accessing all that goodness. So it's not as though cancer should be this frightening thing that is going to consume us we can't fight. Of course we can. We can get through this, but only if we can access the services equitably and on time. And that gets down to management of the service.
Yeah, and I'm interested to hear you say that, because cancer for so long has been almost the word that dare not speak its name. It's a stigma. People are terrified of it. Is our approach to cancer care something that needs to change? I know you in the medical profession, it's keeping people alive, but maybe there's a more nuanced conversation to be had about cancer.
Yes, I suppose you're very right. In my experience of being a cancer consultant for so many years, I think we need to be able to talk about death, basically. And I think people are frightened of cancer. Of course they are. I'm frightened of cancer. Everybody's frightened of cancer, or their family getting cancer, of course. But the trouble is, if we don't get through that fear, it's something we don't talk about. And it's something we don't want to deal with. And it's the go away, too difficult to deal with. And I think then that conversation needs to change. I think it's as with everything, if you're fearing something, it makes it 10 times worse. We need to have a conversation about death. We are very good at having that with perhaps our elderly relatives, but we need to have that now. And some cultures do it better than others. We've got a lot to learn. But as soon as you can have that conversation and normalize life and death, and then think about, okay, how can we then think about preventing cancer? How can we think about what measures we need to do with either alcohol or obesity or all these other things, and then screening programs, instead of people being terrified to go for screening, thinking this is a good thing, you know, knowing what the chances of being diagnosed and how early diagnosis is going to be so great. So once we have those conversations, then we can move forward together and not be so frightened of it.
And is this something that perhaps needs to start in our education system with our children?
Yeah, I think that's absolutely right. And I think it's so much so that we fear it and we're not. And we also have to think about how we have that conversation. I know some work we've done with our own charity, Radiotherapy UK, is that a lot of people want their information in different forms now, social media, TikTok, other forms where they can get it in the ways they can get it, and explaining it to people just so that we can have that conversation and not be feared, and then we can all help to make the right decisions. And then that will even inform our national conversation about where we prioritize health and what we do, and get people involved. It's really important.
Yeah, and you've used the word a couple of times now, prevention. And I think that in some ways that's key to everything, isn't it? And why have we not made more progress in that area?
I think that's right, because there's good data out now. So I think we all accept smoking gives you cancer, and I think we accept that. We have to also accept, though, is why are people perhaps having behaviours that are actually not helpful? And sometimes, you know, it's not their fault. It's sometimes the stress they're under. It gets back to what we've said before. It's about their education. It's about their housing. It's their social circumstances. And if you're in a bad place, you know, the last thing you've got to think about is, oh, I must make sure I'm eating jolly healthily and being preventative. It's not happening. And I think particularly now we've got to completely rethink our diets and how we do things. But that can't be done without the involvement of our supermarkets and what they're selling and the cost of things. It's easy at the moment. Well, sometimes if you've got not much money, you have to eat the low cost carbohydrates. Then there's the obesity, and then that leads into the cancer. It's all linked together. So that big conversation has to be with everybody as well.
Yeah. And do you think, Pat, that the food industry has played its part or is reluctant to play its part? I'm thinking of sugar. I'm thinking of the 2-for-1 ready meals, all of this stuff that is contributing to the problem. They're bound in one way by, you know, shareholders, but there's a moral issue here, surely, isn't there?
I think that's right. And the evidence is there. You think when we introduced sugar originally for sort of working men in the fields who needed that, and now then we changed to the fructose, that was cheaper and in some ways more addictive, these highly processed foods. I think we have to have that conversation with the food manufacturers, and it is a moral issue because, again, COVID has taught us that we are all in this together. And health is really important. You know, the global economy now is in a really bad state for everybody because of the health related to COVID. So they should see this. And I know who wants to jump first, but it is a moral issue. And certainly the UK, we should have, and we want a healthier nation.
Yeah, and it's probably an issue that somewhere like St. George's House could really help with the debate.
That'd be fantastic if they could get involved, and that's where you want to have these discussions of these problems that are really big national problems, to take some time out to just think laterally with people who are much more skilled and have ideas, and think, of course we can turn this round, but what do we do to turn it round?
Yeah, and just focusing in on actual cancer care. I know you and I have had conversations about this before, but I'm always interested in that moment where you say to the person, look, I can give you this treatment and it'll be rough and it'll be tough. It'll give you maybe another 6 months, but there might be a better way for you to approach this. And you've come across that quite often with patients, where better to just let go and enjoy the time that's left without the invasive, intrusive difficult treatment. But
Yes,
that must be a hard conversation to have.
actually, it's not a hard conversation, because as a cancer doctor, your job is to make sure the patient is empowered with all the information given in the most empathic way to help them to make the right decisions for themselves. And I think certainly, years ago, we may not have mentioned the word cancer and we didn't know what was going on. And then I think we're getting much better at talking about it, but there is still the language of cancer isn't helping. The fighting cancer and this type of thing is not always helpful, because and again, it gets back to perhaps we have that conversation about death. And for people, I've seen some very good cancer deaths. I've seen some awful ones as well. And I think it's really important that people have control and they do that's best. And it's okay to actually use your time as you want to do it. And I think relatives have to help the patient. The patient is the most important thing in all this, and they need to be empowered to do what's right for them.
And I mean, one of the things we heard in Sir Leszek's lecture was about the importance of research. And that is fundamental to everything, not just cancer. But I just wonder if you feel, and if the medical professional sector feels in general, that post-Brexit, we've kind of shot ourselves in the foot a little with this. We're out of the loop in some way.
Yes, I think, well, it's post-Brexit. Obviously, some of the problems with the European Horizon approach, but obviously that's being looked at. But I think the problem is the lack of money. Only on Tuesday this week, the National Cancer Research Institute said it had to fold because the partner charities couldn't afford the money anymore. They couldn't actually run it. So I think, I know some of the, I know CR UK have put out press releases. They're tens of millions short in their funding. And so we don't have as much money for research for cancer. I do think that the government has relied too much on the charity sector to actually fund cancer research in the UK. In America, we have the National Cancer Research, the National Cancer Institute. It's government funded. I think we do need to get back to that solid funding and not be funding ourselves all the time and just supplementing it. But we mustn't get away with cancer research is absolutely vital and in all sectors. But at the moment, the priority is to make sure we can get the health service back together again and be delivering treatment on time, as well as increasing our research.
Yeah, and I just wanted, when you mentioned the cancer charities, one of the things I've often thought is there are so many cancer charities, it's so disparate. I wonder if it weakens its impact. I don't mean centralize it in any way, but it may just spread itself too thin. Is that possible?
I think it depends what the charities are there for. I think if it's research, then sometimes the smaller charities are doing research in a very small, important area. For the rarer cancer charities, there are ways we get together as cancer charities as well and have a collective voice. In my own area, Radiotherapy UK, we represent the frontline staff and radiotherapy patients. It's very niche. So in fact, it benefits from having quite a niche area. And as long as we can use our collective voice to actually then talk to government, I think that is the right balance. But my concern is with the research, the government has left it to the cancer charities, and of course then too much. And then now with COVID and revenues coming down, then we're in a double mess. So we've got to be thinking ahead. And I think we have to accept, as a nation, we're not as rich as we were, and people are having all sorts of problems. But again, it gets back to, we need our health and we need to invest in that. And then this country needs to get back on its feet again. So
you don't see the possibility of us going down the American route, where you're whipped into A&E and the first thing they ask you for is your credit card?
No, it would be an absolute disaster. We must avoid that completely. And I don't think anybody would do that, and it just wouldn't be accepted. We want it so that it's for everybody, collectively putting our money together so that we can all share in the health, and as a nation be healthier. There's huge disparities of health in states, and it shouldn't be on how much you can afford at all, ever.
Yeah. I think looking back at the founding of the NHS just after the war, etc., it is a wonderful ideal, free at the point of access, etc. But maybe in the current climate, it has to change.
I think that's right. And I think I've heard people in power saying, oh, it won't be accepted. But I think people are not stupid. They want it to change. And a friend only the other week said that she was in the Science Museum in a queue, and the ladies behind her got chatting, and they were talking about radiotherapy and cancer and how it had to change, and saying basically, great idea in 1945, it's got to change, you know. So the man in the street will know it has to change. Of course we want it to change. People don't want to be on these long waiting lists. We want it to change. It needs the government to be bold. But I think that would start by having a national conversation, because then they know they've got the support. Nobody wants it the way it is.
Yeah, and I think, I couldn't agree more. I think it's absolutely the rationale for the national conversation. We're coming up to a general election. So is this going to be kicked into touch until a new government or whoever is in place?
There is that danger, of course, but again, I think it would be very bold if it wasn't, and if all the major parties could come together and say, we will have it completely apolitical, we will work together to get this right. And I think whoever made that suggestion, they would win an awful lot of votes.
I think that's absolutely right. I wonder as well, when I look at secretaries of state for health, often appointed without any experience of the health sector. They're just politicians put in post. And I always think back to the 1960s and the Kennedy administration in the United States, where they got in the brightest and the best from the relevant sectors to run the operation. I'm sure there's something we can learn from that.
I think there's a lot we can learn from that. And I think that is part of the problem. I think us clinicians feel very outside all the decision making. People have got, there's some such bright people with such a lot to give. And I think actually, again, the COVID short us a lot. I've been interested in the COVID inquiry, what's been coming up as well. One of the things that really comes over is that they're admitting that we need voices that challenge. We need to challenge groupthink. We have to speak truth to power. We should have had far more of that. And also that we needed experts, not just bombing in sage, but experts constantly. And it gets back to this accountability and people constantly independent who've got no axe to grind, but say, look, this is what will happen. This is what will happen. I think for a lot of us, I think if you're in the subject of medicine and if you're a clinician, you can see what will happen if various things happen. So many of us at the start of COVID could see what would happen if you did so and so. You know it in your bones. That's your job. You know, you're trained to do that. And I think that's what people who are not clinicians or don't have, and that's not their fault. It's just they're not trained that way. I couldn't be a politician, but I think again, if they were bold enough to say, let's engage and have that conversation with the specialists as well. I know in the cancer environment, there are so many ideas. I've written in Lancet Oncology about it. There are so many people with so many ideas. They could sort it out. You know, the ideas are there. The amazing people are there, and give them the tools. So it's not rocket science, but the current system, we don't do that. But as you say, and in America, because they've got these National Cancer Institute, all these people, they've got these people that are there to advise the government. When we had a previous cancer czar, Sir Mike Richards, did an awful lot of good. He was appointed by the government to hold the NHS to account and tell them what they were doing right and wrong.
Yeah, I mean, I think you'd make a very good politician, frankly, but I wouldn't wish that on you. But we've had a senior politician who has said recently that we've had enough of experts. So the tide has kind of shifted, and surely we've got to bring that back round. We need experts.
Well, if somebody thinks they can get themselves out of this NHS mess without experts, fair play to them, but I think they should be held account for that decision as well.
And Pat, just turning more personally now, I'm just thinking about your route into the work you do. How did that come about?
Well, I'm pretty much a sort of an accidental campaigner, really. I was going about my business perfectly happily in my own research and clinical, and I'd set up the charity Radiotherapy UK. And then as soon as COVID hit, the phone started going. People saying, I've just been told my cancer operation's been cancelled and I don't know what to do. And it was heartbreaking. I tell you, that first lockdown, there were many a night I was in tears. It was so desperate. And again, as a cancer clinician, you completely get that, what's out there and how they were struggling. So then we were secretariat to an all-party parliamentary group who has been terrific. Tim Farron with the radiotherapy group, Graham Morris, Gillian Keegan at her time when she was more junior, really trying to help. And then we got together and then talked to, actually, Jeremy Hunt was very helpful. A lot of politicians saying, how can we help now? A lot of the advice was get the media on side. Then we set up the Catch Up with Cancer campaign. And I must say the media have been hugely helpful in terms of what we try and do is get data and then we see what's going on and try and communicate that via the media or directly with politicians. Although I must say that seems a terribly complicated way of doing it. And we just don't have the data and can act on it. And it's just spiraled from there, really. And then other things have happened, like because of the COVID crisis, we set up an international global coalition for radiotherapy. And that helped us. We had 3 weekly across the globe as it swept over what to do with cancer, seeing what other people do. It was magnificent. And then that was repurposed when the Ukraine war was then, because we could set up a task force, we could interact with the cancer physicians on the ground remotely, see what they needed, help get the international community around. Technology has been great for these sorts of things. So there just seems to be an awful lot of need at the moment. And that's what I think. I was always brought up to basically to be told to use your talents that you've got and use them to help others. And I think that's what most medics feel. And they just think, how can I help in what way? And I seem to be in this position at the moment, trying to help in this way.
Which makes it all the more difficult and sad that we have junior doctors on strike, we have consultants on strike, we have nurses striking.
And none of them want to strike. None of them want to be on. And it's a bit about the money, but it's not all about the money. It's their cry for help. I've been screaming about this. First letter written to Matt Hancock was the 1st of April 2020. I've been screaming about it for 3.5 years. And essentially, this is what the staff are doing. They're just saying, look, you need to save this. You need to do something about it. And I think we must recognise it's great that this workforce plan now is coming forward. That's great. And Jeremy Hunt announced that a while ago, which is good, and all these things put in place. But I think we mustn't forget the frontline staff are the most amazing people. And they have been through so much with COVID, really. When the rest of us perhaps could be at home, they were absolutely on the front line, risking their own lives and some of them losing their own lives. And they've worked hard and then there's not enough staff and they're having to work harder and then there's more vacancies and there's this constant spiraling out of control now and they see it. And they're basically screaming, saying, will somebody do something about this? And again, we need to listen to that, not just in the pay area, but we must listen to that, saying, well, look, we understand. So give them the tools, sort of be nice to them, sort of stop telling them what to do and show them that there is something there. And there's an awful lot to be done and get them in the conversation as well, knowing that they will be somewhere. There's nothing worse than feeling that nobody's listening. And that's what they're doing, is just screeching out. And with all this crying out, when is somebody going to be bold enough to do something and do something radical? Tinkering around the edges, no good.
Yeah, perhaps a royal commission?
A royal commission, certainly. I think we need both. We need a national conversation with people and medics and whatever, but a royal commission to work out how we are best to do this now. And there are good people, the King's Fund, there's all sorts of international models, people that are much better at how we can, than I am, at how do we run a health service with the essence of what we want, and yet with the putting the patient first, and above all, increasing our survival. We went into COVID, things are deteriorating then. Cancer weights, it's important to treat on time. Our weights were right down, and then COVID happened, they've dropped through the floor. So we were in a bad situation to start with, and it just got worse. And for cancer, and I know it's in every area, so I don't want to go on about cancer, but it's obviously my area. But it's probably one of the most urgent backlogs, and it's the most deadly. For every 4 weeks wait and delay, there can be up to a 10% decrease in death rate. That's important. 1 in 2 of us are going to get cancer. And so we know somebody, we all know somebody. And also CR UK have said there'd be likely a 30% increase in cancer cases by 2040. If that's not a wake-up call to say, do something and do it now so that it will work. We've a lot of diagnostic increased funding, nothing for treatment. How are we going to treat these patients if they're diagnosed? And again, I learned from the COVID inquiry, it was tough because they were planning for another pandemic, and you don't know when you're going to get one. But I tell you, it's a dead cert here. We're going to have cancer incidence increasing. That's not negotiable. That's what's happening. So let's get our skates on and don't say, oh, didn't know. You do know.
Yeah, fair point. And where do we stand at the minute in international comparators?
Sadly, very low. There is an international organisation, the International Cancer Benchmarking. We went into COVID at one of the bottom of the Western countries, and the King's Fund that has just come out saying, again, we're right down, particularly in cardiac and cancer. So we have got to do something. And again, it's not that we haven't got the tools out there to do it. It's just our patients don't access them quickly enough. We don't diagnose early enough, and we don't treat fast enough.
And are we learning from international comparisons about early diagnosis, about methodologies, and all of that?
Yes, I think we certainly know that, which is why it was great when we had the long-term plan from the NHS that we want to increase our early diagnosis from 55% to 75%. That would be great. Remember, if you're diagnosed early, it can be treated. A cancer can be treated if it hasn't spread with either surgery or radiotherapy and cured. So that is, well, apart from not getting it in the first place, that's the second best thing you can do, which is great. But the plans that were put in place to do that, even again, I remember Mike Richards saying it's not going to make it. And now we're well into what we should be doing, and with 2% increase, which is great. But gosh, that's not enough. Gosh, we've got to move faster. We've got to move faster and better on all these things.
And is it true? I mean, I think I heard a statistic that Ukraine is actually doing better than us, and they're in the middle of a war.
Actually, yes, their cancer weights have actually held up, Ukraine, actually, amazingly, and good for them, actually. They have fought so hard on the areas that can do this, and so many countries are doing better than us. I feel that cancer is slipping down the UK agenda now, and that's what we've got to reverse, because it does matter. 1 in 2 of us, it really does matter, and it's something we can get better.
Yeah, and early diagnosis and all of that, and prevention, of course, a lot of this hinges on the GP, doesn't it? And I just wonder about the role of the GP now in this 21st century.
Yeah, poor old GPs, they've got to do everything, haven't they?
Yeah.
They've got to be here today, they've got to be, well, at least some pressure's taken off them for over 40s checks. We don't have enough GPs, right? Fact, and they are run ragged with the amount of work they've got to do. They introduced online consultation so you can email them about anything. Workload is massive, and of course, because we've got the delays in the cancers in the hospital, they're ending up now dealing with a lot of patients with cancer who haven't actually been diagnosed or treated, so they're in a really difficult situation. So what we need, obviously we need that tomorrow, that workforce to come out with more GPs, but we then need to think, don't leave them on their own to do this. There are other people that can help. As you say, if the food industry would move things around so there was less there. There are other education in schools, if social housing was better, all these things that would help, not just leave it to the GP. And certainly what I have seen so much of is trying to have the blame game. Don't blame the GPs. This is not the GPs. They are just one, and we need closer links between the GP and the hospital so we can get together. But ultimately, I think the NHS have just got to come to admit that things are wrong. I see so much talk about everything's getting better. It's not getting better. We had to point out to them that their 62-day backlog target, which they said was getting better, it was, but that was only speeding up, excluding people without cancer. The actual real proper target, about 62-day waits for treatment, was deteriorating. So again, of course we want good news and we want to have hope, but if we keep saying things are okay, then nobody does anything about it. So can we just do something about it?
Yeah, which again, I think is, as you say, this national conversation out of which emerge the wishes of the people, the priorities of the people, and then it becomes an act of persuasion for those who can make the real difference.
Correct.
That has to be right across society.
Yeah, absolutely, absolutely. And the UK can do it. We're a nation that can do that.
And I know that you've run, is it 7 marathons now?
Yes. Not very fast. I took up running about 10 years or so ago, partly for mental health reasons, partly to get fitter. And then I thought, if I can't run fast, I'll run long. So I have done the last 7 London marathons, and my aim is to do the next 5. And then if I can keep up my pace, then I might be in a better category then, but I'm slow, but I keep at it. So, and again, exercise for everybody. I'm a bit passionate about that.
And does your time improve with each marathon?
Yes, actually, I have improved my marathon time, but it's still pretty slow, but I get a lot of help. And also, I think that's something that we are really passionate about for mental health and feeling good and feeling fitter. In fact, if people go to our Radiotherapy UK website, we've got a Miles for Radiotherapy starting next month, 3 months virtually. Everybody can just run together, clock their times, and we can get healthier as a nation.
Yeah, and it's so interesting that you speak about mental health, because there's a conversation that has been happening a lot more.
Yes.
When we were young, mental health wasn't mentioned. It was completely
Exactly
off the agenda.
I think that's right. And you think of that, think of the other thing that's changed. People don't drink and drive anymore. And actually, we don't smoke indoors anymore. So you can change things. And it's a great conversation about mental health, because who doesn't feel the need for that every now and again? And if people, imposter syndrome and all these things, this is just what goes on. We must talk about it.
Yeah. And why do you think we've got to the stage where we can talk about it? What was it that shifted the debate?
I think actually quite a lot, partly force of numbers, but also high profile people, celebrities, royalties, and then and wrapped up with that in a positivity of what you can do. And I think that is a conversation. It's on the TV, it's on radio programs. And if we could do that with talking about cancer and death and what we want to do and life in general, and particularly what we want to do, the health service, that conversation begin going on in pulpits, in radio programs. It can be going on anywhere, in celebrities getting engaged, and perhaps move the conversation on from fighting cancer to having a conversation about it.
Yeah, and perhaps seeing it less as a problem and more as a challenge.
Yes, exactly, as a challenge, exactly. And being able to talk about it. I was on just TV on Monday, and we ended up just talking about sort of screening and the importance of that. And over breakfast TV, I thought, great conversation, because if it helps one woman pick up the phone and have a mammogram, or if it helps one person complete their fit test for bowel cancer, and if that saves a life, terrific. Let's get on.
So we can do it. Pat, we're coming to the end of our time, and I'm so grateful to you for taking time out to have this conversation, because I know you're ferociously busy. But I know as well, and our listeners might be interested to hear, that we are going to do further work on the radical rethink around healthcare. And if we at St. George's House can help kickstart something, then all to the good.
Yeah, no, I think that would be great. And if we could do that, that would be fantastic. And really, we need to think of to get as many people who would be inspired by helping into that big conversation, because we need the best brains and the lateral thinkers. And as they said, people who can challenge and with knowledge be great.
Yeah, and I think what you've hit the nail on the head there when we say lateral thinkers. We've got to be thinking about people from other sectors completely,
Yeah.
not just an in-house health talk.
Oh,
People
exactly.
to learn from across the sectors.
We do enough of that already. We have enough of those conversations. We need to open this conversation out absolutely as wide as possible.
Terrific. Pat, thanks so much for your time tonight. It's been a huge privilege to talk to you, and I very much look forward to taking this conversation and our other conversations forward over the next weeks and months. But it's not a problem, it's a challenge, and let's crack on with it.
Thank you. Well, I'd like to thank St George's House for being so proactive about this. This will be great, but also to thank, you know, all our patients out there and all the frontline staff who do such an amazing job. And if people wanted to know more about the Catch Up with Cancer campaign, it's on the website, Radiotherapy UK. You can see what we do. And let's all do this together, move forward.
Absolutely. Thank you very much. And thank you also to our audience tonight. Thank you for tuning in. A recording of this will be available on the website very shortly. But from me, from the Vicar's Hall and from St George's House, thank you and good night.